This is Jennifer Burke. She's here from Taylor Physical Therapy. So take it away.
Yeah. Do I just point at that?
You can point it anywhere. Yep.
Anywhere. Okay. And just
The next. Yep.
these
Yep.
ones. Okay.
Mhm.
Okay. So as Amanda just said, I am Jen Burke. I'm a physical therapist upstairs, and I'm going to be talking about injury prevention and exercise, and also sharing with you a new program that we have available. Okay. So first, to get started, we're going to talk a little bit about the benefits of exercise, because I think the benefits of exercise always outweigh the risks. It's just knowing how to make sure that we appropriately work our way into exercise to make sure that we're getting those benefits and not getting the risks. So some of the many benefits of exercise are weight control. Exercise combats many health conditions and diseases. A lot of these are all things we know. Helps improve mood, boosts energy with improved lung and heart function and capacity, and also promotes better sleep. So the list goes on and on. I was at a course recently and I loved this little quote that they had put up and said, currently there's no drug on the market or being developed that is better for treating our health than exercise. And I think that is very, very true. It's just something that is easily overlooked and can take a little bit of effort to do. So, but I love that. So there's some exercise recommendations that will help increase the benefits of our exercise. And the current recommendations are that we are getting 150 minutes of moderate exercise or 75 minutes of vigorous exercise. So moderate is something that's going to increase your heart rate and your breathing. You can probably still talk while you're doing that activity. Vigorous is going to be a significant increase in your heart rate and breathing, so something maybe more along the types of like running. Some of our higher intensity exercises are going to fall into that category. You can also do a little calculation with your heart rate to be able to kind of determine if this is a moderate category activity or if this is a vigorous. So moderate is going to be about 50% of your max heart rate, 50 to 70%, and then 70 to 85% is going to be the vigorous. And we'll talk a little bit more about that later. Strength training is also hugely beneficial. So starting in our 30s, we're actually going to start losing some of our muscle mass, unfortunately. And so strength training is very important to help maintain our bone health, and our strength to kind of help with our future and just our ability to have good balance and good stability as we age. So we're going to talk a little bit about several main categories that I came up with that I think are common mistakes that people get into when they are exercising. And we're going to talk a little bit about those mistakes and then how to combat them. So the first one that we're going to be talking about is form and technique. So I think this is one that is really hugely beneficial if you take a little bit of time ahead to do some research. Okay, so if you're going to be getting into a strength training program, maybe do a little bit of research either in books, online, magazines. I think we have a lot of great resources that are very readily available to us anymore to be able to talk about, okay, what are those exercises that I should be doing? I think it's always great to think about strength training for those larger muscle groups, our core, our hips, our legs, some of those big ones that you kind of immediately think of are ones that we should be doing, and then also some exercises just to be kind of fine-tuning. So make sure you research your exercises. I usually think if we're targeting doing about 5 to 7 exercises in a strength training routine, that's a pretty good number. And if we're working on the whole body, that's also a good thing as well. And when we do our research, we want to think, okay, what are they telling me about form when I do my research and when I'm looking at these exercises that's going to help keep me safe. So also getting some verbal feedback. So if you're working with a physical therapist, am I doing this correctly? They should be giving you some input. If you work with a personal trainer or a gym manager, some of those individuals might also help just improve safety while you're doing new exercises because they can give you that verbal feedback. Additionally, there are lots of exercise equipment that we can be utilizing, like if you go to a gym. And so I think it's always good to go through and do their orientation to be able to see, okay, how do I properly set up this machine, and how do I make sure once the machine is properly set up that I am using it in a way that's appropriate for me. So maybe it needs to be lined up in a certain way. And just knowing that, having good understanding of your equipment is very, very important as well. I love using a mirror. So I think this is an area where sometimes people feel a little bit self-conscious because we kind of think of our stereotypical weight gym users, and they're kind of in the mirror and very intense. But I think it's very important to have that visual feedback as well to help keep us safe. And I think that's why they do it as well. So using a mirror for that visual feedback to be like, okay, what alignment am I really in? Is my back in a good position? Are my knees in a good position? And just making sure that you actually look the way you feel, because it's kind of surprising once we see ourselves doing something, we might say, okay, that is completely different than what I thought I was doing. And I think the last part is very important too. So there's going to be different days for everybody. Some days we're feeling really, really great, and what we do at a gym or what we do outdoors or in our home to exercise might be different than a day where maybe we're feeling a little bit under the weather. We're not very rested. Maybe we did have a little bit of injury and we're kind of working on coming back from that. And so the most important thing that I can really stress is that every time you're doing a movement, you're doing good quality movement and not getting so fixated on the length of time that you're doing it, the number of sets or number of reps that you're doing it, but that every single time is a really good quality movement pattern. And I'm going to put a little plug in because we do have a new program that is kind of targeted exactly towards form and technique. We have a runner's clinic. So this is going to be geared towards our recreational and our competitive runners. And what we're doing with this is we are doing a movement screen. We're looking at strength and flexibility, and then we're doing gait analysis, because just like I said, having that verbal feedback and that visual feedback can be really important. And so we are kind of specifically targeting our runners with this. So if you know anybody or you are a runner and are interested in ways that you can decrease your risk for running by having an assessment done, this is a great new program that we have available. Okay, so moving on. The next category for injury prevention is the quantity. So, too much, too fast. We see this happen a lot in the springtime. People have been a little bit more sedentary in the winter, especially in Iowa. That's a very common thing. It's harder to get outside. It's sometimes that it's dark. It's just harder to be motivated. So, going too fast, the spring, the nice weather hits, and we think, I was walking 3 miles last year. I am going to do that again. And so we head outside and we go to town doing that activity. And what we realize is that our body has adapted to not as much activity. And so we need to take the time to build back up to be able to be appropriately adapted for that activity. I usually suggest, for numbers of reps and sets, it kind of depends. If you're looking to build more endurance or if you're looking to build more strength, that's going to vary. So if you're more on the strength aspect of things, you're going to do less reps and you're going to do maybe 2 to 3 sets of those. If you're looking for more endurance, you might do more repetitions and you might do more sets as well. So making sure that you're utilizing an appropriate amount is also very important, as well as kind of just working into things slowly. So remember, I think the little phrase that they use with medication, go low, start slow, I think, or maybe it's the other way around, but it's the same is true for exercise prescription as well. So you want to start with a lower amount of resistance or a lower number of time, and then you just kind of want to slowly work yourself into things. And this is usually a very good way to combat getting an injury. Also utilizing training programs and making sure that you're training an appropriate amount. So the opposite end of that is overtraining. So sometimes we see that happen too, where people are maybe have an event that they want to do and they are very passionate about it, they love it, and so they're almost doing a little bit too much, and so that's kind of a recipe for disaster too. So making sure that you kind of find that sweet spot where you're doing enough, but you're not overdoing so that it's too much for your body. And that kind of plays into our kind of factoring in our extrinsic factors. So like I had mentioned just a little bit ago, sometimes there's other things that we bring to the table when we are going to be doing exercise for a day. So rest or sleep is an important one. Maybe last night was a really bad night of sleep for whatever reason, and so your body is just feeling a lot more fatigued. Its ability to handle exercise or activity on that given day might be reduced as compared to other days. So just kind of thinking about that. Today might not be the day where I want to do a sprint workout, or I'm going to boost up my weight on the squat machine. Those are maybe not your best day because your body might be at a little bit more risk for injury because of just the fatigue. Sometimes I think we have changes like in stress. We might be feeling a little bit more anxious. Maybe we're feeling a little bit more down and blue. So some of those just mental factors that we're also dealing with on a particular day can also have a tremendous effect on how well our body is able to sustain whatever we're wanting it to do for activity level. And there's also like, sometimes we get cold, sometimes we have some viruses that attack our body, and those things are also going to change the ability for our body to be able to adapt to whatever we want it to do for activity at that day. So I think, there's going to be fluctuations with any exercise program, but also realizing it's not always just like what you're doing. It might be something completely separate that we didn't think had an effect on our body, but probably maybe is. So quantity is good to think about. The next thing we're going to be talking about is quality. We tend to see this a lot in the gym upstairs, especially with our younger patients, where they like to text and drive, as I call it. And I say, we are, just like we don't text and drive on the road, if we're riding the bike, we do not get to use our phones, because exercise is good, as long as we're moving, that's a good thing. But you're going to get a lot more bang for your buck if you're putting a little extra gusto into it, and it's hard to do that when we're on our phones. So we don't text and drive upstairs in the gym as much as I can possibly control that. So one of the laws to be able to improve our physical fitness is a principle of adaptation. So we want to stress our body in a way that we actually see changes. So like I said, just like this gal that's great, she's at the gym, she's using her legs, but maybe she's a little distracted in her exercise. It's going to be a lot more beneficial if she actually would be able to focus more on her heart rate, her intensity level, and is making every minute of her exercise count, rather than I'm just kind of going through some of the motions. So again, exercise is good, but I think we all kind of want to get the most health benefits as we can. And so by putting yourself in a category where you're stressing the system enough, so you're putting enough overload on it, but not too much, is the area where we want to be. One of the ways that I like to do this is monitoring your perceived exertion. So there's a perceived exertion scale, and it kind of goes from like I'm doing nothing to I need to call for roadside assistance because I'm down and out. So monitoring that will be really helpful. And sometimes people like to use that a little bit more than, say, their heart rate, because I know, speaking from myself, I have a very reactive heart rate, so it doesn't take much for me to get to the outer limits of where my maximum heart rate should be, but I don't necessarily feel like I'm capable of being able to do more. So that's a nice scale if you're similar to me. Otherwise, we calculate our perceived, our max heart rate by a little formula where we take 220 minus your age, and then we multiply that by 0.65, so that gives you the lower end, and 0.85, that gives you the upper end. So there's a nice little formula that you can use to also just see, okay, when I am exercising, where is a safe range for me to be based on these guidelines? Your doctor may have given you different guidelines, but that's one that can be used fairly generally. So the other thing is just quantifying some of your mechanical stress, which sounds kind of like a big thing, but really all that means is we're just kind of factoring in what activity we're doing. So with the stress that's on the body, if we think about the low end of the spectrum, swimming kind of falls into that. So swimming is a very safe activity for a lot of people to be able to do. It's very rare that I have anybody that comes in and is like, oh, I just got hurt swimming. That usually doesn't happen. However, on the opposite end of that spectrum is like plyometric jumping type activities, and we do see that a lot with basketball, volleyball activities that have a lot of jumping are kind of a higher impact activity. So just kind of monitoring that too is also going to be something that plays into, and it's great to have some variety with these activities. It's not one's better than the other. It's just a matter of just kind of taking that all in when you're thinking about the quality of your workout. So another area where we kind of see some mistakes or areas to improve is just training too specific. So somebody does the same exercise every single day, or they're doing the same weight training exercises every single day. So I think there's a lot of great benefits to cross training. I think this is, especially as our body ages, it's good to have some diversity in what we're doing to make sure we're working different muscles. We're working kind of endurance and cardiovascular endurance, as well as our strength. So it's good to just change things up a little bit. So we definitely know with cross training we're going to reduce risk of injury. And it's also good too because it helps with just keeping us motivated. So if you're like, today is this type of day, this is my walking day, and the next day is my yoga day, or so on and so forth. I think just that keeps us more mentally stimulated with our activity as well, and that just keeps us engaged as well. So that can reduce risk of injury, and it just improves our overall fitness. And lastly, what I was going to touch in, this is not necessarily what I would consider one of my areas of expertise, but something that I think is very important. And so our nutrition and our hydration are very important. So I think I recently read a current recommendation for hydration is drinking to thirst. And that kind of seems to fluctuate from time to time in terms of, especially like with endurance sports or different activities like that, just where you're doing a lot of sweating. And then your nutrition too. So how you put food into your body. I like to think of food as your fuel, and how that's going to play out into your activities that you enjoy doing. So if you're maybe more of a walker, a jogger, if you're more of an endurance type of athlete, then it's going to be important for you to have a diet that has carbohydrates in it. You need that for activity levels. However, if you're more into weight training and bodybuilding, then a more protein-based diet is going to be important to you. So I think just considering that as you're thinking about your fitness goals is just making sure that you're putting the food in your body that is going to help your body be successful, because that's ultimately what it needs. And also with the hydration at this point in time, it's hot, it's humid. I think that is an area that we can kind of help prevent injury too, is just making sure that we're really taking our hydration into consideration when we're doing different activities as well. So I left plenty of time for questions because this is a large topic. And there is some good overview. So if you have any questions, I would love to answer them.
I have a couple.
Yes, okay.
So I've heard when you're sick, sometimes you can sweat it out.
Yeah.
So is that not a true, or is that a true, or does it depend on what you got going on?
I think it, well, I think your body, I cannot comment on that necessarily with a distinct like yes or no, true or false. I would say I'm similar to you, where sometimes I'm like, if I go exercise, I'm going to maybe sweat this out, or I'm going to feel better. I think your body, like the immune system, still has to probably go through the whole process of being able to eradicate like those viruses or germs or whatever is making you feel sick. But I think there's definitely something to consider when you are sick, is that it might be a little bit more taxing on your body because your heart rate, I think your body temperature elevates, and so that changes your heart rate as well. So it might be, if you monitor your heart rate, a lower intensity type of exercise might be a little bit better if you're feeling under the weather. So probably won't help you feel better faster, but it is something to consider that you might actually want to scale. It's okay to continue, I mean, as long as you're not getting everybody else sick and you can do it, but to scale back a little bit, just knowing that your body is going through that physiological process of kind of fighting off those germs in your body. But yeah.
How do you know if you're overtraining?
If you're overtraining, I think that is a tricky question because everybody has a different capacity. I treat a lot of chronic pain patients, and we talk a lot about this cup. And this cup is different sized for every single person. So there's these factors, like our intrinsic factors, like your health, your genetics, your background. There's a lot of these factors that are just kind of like you, right? And then we have these extrinsic factors that come into play. So like weather and shoes, just there's different things like that too. So we kind of have all these different factors, and we have this that makes up this cup. For one person, it might be that your cup is pretty big and you can do a lot within this cup. And then there's another person whose cup is smaller than the cup over here, who they can't do quite as much. And so to say like there is this level of overtraining, it's kind of difficult because every person is going to bring something different to the table to be what does overtraining look like for them. I think though, if you're starting to notice that injury is happening, that's probably a good time to assess whether overtraining is part of the issue or not.
So I was told if I start weight training again, I need to start with 1 pound weights and gradually work up, because every time I would start, I would get injured and end up in physical therapy. But my goal is to bench press my weight again and get back to where I was when I was 20.
That's a great goal. Yeah.
So,
Wow.
but starting off with these few pounds just seems trivial, and I can't motivate myself to start with that little amount.
Yeah. So I would say that, again, this is one of those times where it's kind of difficult because the formula is different for every person, right? So I would say that not knowing your health history and the different injuries that you've sustained, maybe it is appropriate to start at 1 pound weights, but then the next day, I'm doing pretty good. So really what we're looking for if you're coming back from an injury is, do you have pain with this activity? If you have pain, is it a mild, is it a moderate, is it a severe pain? Pain is not necessarily a bad thing that we have to completely avoid. It's a good thing, it's a protective thing. If it's mild, I usually let my patients know. It's up to you if you want to work through it. If we start to get into that moderate, severe, then there's probably a better exercise or we need to wait on this. So pain is always a good guideline. And then how you feel either later in the day or the next day is also. So it might be that you feel sore later in the day, but is it better by tomorrow? And then gauging that is also going to be good to know, like, okay, do I continue with where I'm at, or am I able to progress? Or do I even need to scale back a little bit? So if you do your 1 pound weights and you kind of go through your routine and you're like, okay, I had no pain with any of that. Well, you just checked a box that was good. You have no soreness later in the day or the next day, then I would probably say you're pretty safe to say, okay, the next time I'm going to try 2 pounds and see how that goes. Okay, did I check all the boxes with that? And then kind of just slowly work yourself up. It's also important to have those days of rest in there. So to make sure, okay, yep, okay, that went well, rest, yep, that went well. And I think given your history of weightlifting, it sounds like you have a pretty good history of that, where you've done it in the past. You kind of know, like, there's soreness that comes, and then they kind of hit like a sweet spot where you're like, I feel sore, I feel like I did something, but you're able to kind of engage in exercise. It's not a debilitating soreness where you're like, I gotta hang out on the couch for a little bit. So finding that area and then using that to kind of build from there. And then it's obviously gonna become a lot slower, right? Where it's like, okay, it's not the next time I'm going up in weight, now I probably have to hang out here for a period of time before I can consider going up to and weight again, so. Yeah, but I think those are kind of the big ways that I encourage my patients to monitor their activity and their exercise and make sure that they're appropriately progressing from there. Good question.
Other questions? Too many, can't narrow it down.
What is the best form of exercise in your opinion?
In my opinion, the best form of exercise is any exercise that you love to do.
I knew she was gonna say that.
Yeah, yeah.
Some people are like, you should walk, you should
Yeah.
swim, you
So
should.
when you look at the research, I mean, that's kind of out there. Walking is probably the best if we want to like categorize like it against all the others and consider the benefits and the risks that are associated with it. Walking is probably the best. It's cheap, it's easy, your risk for getting injured is very low, it's accessible to a lot of people, so it's one of the best exercises. When I'm talking with my patients, I'm like, let's talk about what makes you excited first, you know, like if biking is your thing, then let's focus on biking. If walking, running is your thing, if you love the water, because you're not going to be compliant with any exercise that you don't enjoy doing. So there might be a few that you have to throw in there, but I think the best exercise is the one that you just really like to do.
As in picking out shoes, what's your suggestion with that?
As far as shoes go, that's a very broad question as well. So as far as shoes go, I have been practicing physical therapy for about 10 years. I've been working with runners for about that length of time as well. And shoes have like changed dramatically. So there's always like these shifts in footwear and just the recommendations that we're making. So 10 years ago, it was all like, okay, we're gonna really assess your foot. Do you pronate? Are you neutral? Are you supinated? So like what your arch is doing. And then we have neutral shoes, we have cushion shoes, and we have like stability shoes. So we're gonna fit you exactly. And then it kind of morphed. We kind of went through like the barefoot running era. You saw like all the finger toes and all of those. So that kind of changed as well. And now we're kind of back into this category where we have a lot of shoes where I can't tell what they are. I don't know anymore if they're a neutral shoe. I don't know if they're a stability shoe, just because all the shoemakers are starting to diversify themselves, and so there's a lot of different components and technology that they can use now. So the world of shoes has become very big, that I will usually suggest to my patients that they go to, if they're for the first time, go to a shoe store, and then just kind of get some information there, some recommendations. But across the board, and I think good shoes are really important, and they become more important for certain populations that are on their feet a lot. And I don't want you to hear me say like that means you need to have a really stable no bending, super cushiony shoe. That's not exactly what it means. It just means like a shoe that you feel very comfortable in. That's the type of shoe that's best for you. So I tell people if you're trying on shoes, walk around in them. Make sure that they feel good. They're not pinching on your toes. You have plenty of room. You feel cushioned, you feel supported. Those are the shoes that are probably going to be a really great starting point anyways. If you've had some injury, then there's some other suggestions that can go into it, but I think that's a good place to start.
So like for your gait, is it
Mhm.
important to have certain shoes for the type of gait you do have? I know you were saying that,
Mhm.
that you're doing a gait.
Yeah.
Do you guys have a gait thing up
So,
in physical therapy?
What we do have a treadmill up there, and then we have the Alter G, which is the weightless treadmill that's
Right.
up there as well. So what we're doing is we're doing video analysis. So we are taking video and then we can slow it down. So it all depends on you. I have a runner that I was working with a few weeks ago, and when they stand, they look great. When they walk, they look great. When they run, their feet really collapse in. So for that person, it probably is important for them to have a shoe that gives them a little bit of support, just because that's going to change their mechanics or help change their mechanics enough. Now we can't forget that there's a lot of exercise that goes into that to also help correct it, but for the time being, some of those like external devices like a shoe can be super, super helpful. So it just depends on what you look at. But I think more than anything is the foot is a piece of your body, a part of your body that is moving in so many different directions. It's hard for me just to look at you and be like, yes, you should have this type of shoe. So it is a very complicated, because your foot might change when you walk or run or
So if you go to a place like Corner's Flat,
yeah, right.
and they have the machine, you need to do what exercise you're gonna be doing to pick a shoe?
That's what they
Would
like to
you
do.
s-
Yeah.
okay.
Yep, I think
Would
that's
you
what they like to
say?
do. Yep. And if you've never, I think once you kind of have gone through that process, I think it's a good thing to do if that's something, a passion for you. Like walking or jogging, I think it's a good thing to go through at least once. And then once you kind of understand what your foot is doing, I think it makes it much easier than to like buy shoes on your own as well. So I think there's a lot of benefit to that sort of thing.
And is it important to have like different types of shoes for different workout activities too?
I think, yeah, I do think there's some benefit to that. So I think that that's a personal decision, but as far as like strength training goes, if possible, depending on where you're at, like I try not to do strength training in my shoes so that I work my feet muscles a little bit more, because I'm not doing a lot of heavy impact on them. So I will go without shoes to do it. So a more minimal shoe, which is why you see sometimes like at the gym, people who maybe do a little bit more weightlifting, they're fine in a more minimal shoe because they're going to get a little extra benefit from it, because the shoe is not supporting them quite as much and keeping them in a certain position. They get more feedback from the ground that way, and their muscles.
So would
Act a
that
little bit
be considered like a T-Rex type thing? Would you consider that weight
Wait,
training?
yeah. Some of those functional training. Yeah.
I got her, I'm using
Yeah.
her.
Uh-huh.
I am the question girl.
Yeah, that's good. Very good questions.
Anything else from anyone? Okay, thank you
All right.
very much.
Yes, you're welcome.